common pelvic floor mistakes hold you back? Discover essential tips and exercises for lasting relief. This video is rather comprehensive, and I'll be going over some of your great questions that are not as easy to answer. I'll go over questions like, what are the top 3 pelvic floor mistakes you can be making? Should you stop masturbating if you have pelvic pain? What does ejaculation? Why does ejaculation actually sometimes relieve pelvic pain? How are calf cramps linked to pelvic floor issues? And what to do about mystery tailbone pain with no injury. Bear in mind that I'm no sex therapist, and I look at pelvic stability as a source of most pelvic floor dysfunction issues. This is an approach that is not commonly taken in the world of pelvic floor therapy. Within my understanding and what I've seen, which is, in my opinion, a mistake, because we want to make sure the pelvis, the house that pelvic floor is the floor of, is nice and stable. With its stability, the muscles inside your pelvis, that's inside versus outside. The muscles inside your pelvis don't have to modify their presence to make up for what's not happening in the picture. So let's begin. What are the top 3 pelvic floor mistakes you could be making? First is that pelvic floor issues have to do with incontinence, sexual dysfunction, and pelvic pain only. That is 100% not accurate. There are a lot of other presentations that are happening without you realizing that's pelvic floor dysfunction. Frankly, it's not just you, it's providers that overlook the connection. We basically fail to realize that pelvic floor dysfunction comes in many shapes and forms, including chronic lower back pain, SI joint pain, hip mobility issues, poor posture, improper breathing, and more. Thinking that we can isolate muscles and stretch or strengthen them, or that you can basically use basically retrain your muscles using a device, disregarding the fact that muscles in question or muscle in question is simply responding to the environment it's in, and that changing its status is not going to change everything else that is leading to it being at the current state, is another mistake that's taking place. Please understand that I'm not saying the issue is not fixable. I'm saying that, in my opinion, we're busy doing something that may work short term, but not long term. You want to chase the why. You want to know, why is the muscles inside the pelvis changing its tonicity? I didn't say pelvic floor because the floor is not living by itself. It's the whole thing. So then, why does ejaculation sometimes relieve pelvic pain? That's a question you may ask. If it's tight, how come if this is sexual dysfunction and then ejaculation happens, how come that is not the same? Once again, from biomechanical perspective, once the muscles relax and the ejaculation is over, the pressure is off and there is some relief. To me, these functions simply let me see what is going on the inside of the pelvis and on the different organs within the pelvis. The solution, in my opinion, is to facilitate the natural grounds for the body parts to perform their job better. So tightness of these muscles on the inside can actually impact the sexual performances, but once again, you want to chase the why. Why is this muscle tight that is causing all these issues? Your body doesn't work against you. It's simply responding to what's happening to it. And so when we charge the body differently and we change the environment, and basically the work is different now, and we work on the functionality of the body parts, these muscles, just like any voluntary muscles in your body, will resume their healthy, normal function when they're dysfunctional. These muscles have had to modify their function based on something else that is not right. As long as that something else is present, these areas will continue doing what they're doing right now. The treatment should therefore be removal of the excuses versus thinking massaging the muscles inside, going through the anus and the vagina, or is going to provide a long-term solution. This is not what's happening in the world of pelvic floor dysfunction. And I'm just presenting to you my biomechanical approach to this. Hope this makes sense. I'm going to answer the next question to let you see what I mean here. How are calf cramps linked to pelvic floor issues? Think about it. Cramps may be from nutritional deficiencies. So aside from that, which you can simply supplement yourself, taking the right supplements, they may be a dysfunction in a specific nerve or movement performance. Bottom line is that we tweak our body either from pain in the calf, or the brain does not automatically do its thing at a level that it needs to be. So that's so subtle that you don't even see it, but it's actually happening. So let's say it is a response to some nerve irritation that does not cause pain enough for you to actually decide to do something about it. Happens all the time. It's like, my leg cramps, it's not killing me, I'm just going to go ahead and ignore it. But the reality, it's some nerve that is showing up as its malfunction, showing up as a cramp. So now, if that was the case, you modify your movement, which now means the lower extremities don't perform proper balancing. That means your pelvis is not stable. Sort of like a table, legs that are not strong and steady. So you can put something on it, but it's not strong. The muscles inside your pelvis and the ones outside the pelvis work together to reinforce the stability of the pelvis. If the outside is unstable, the inside has to make up for it. This means tension, and this tension over time shows up in many shapes and forms. That's essentially pelvic floor dysfunction due to improper mechanics. Now let's talk about that tailbone pain. What do you do about mystery tailbone pain with no injury? That's the question you asked. Well, it's not so mysterious, tailbone pain. It's not mysterious. Tailbone pain can easily happen because there's so many ligaments attached to the tailbone. Your tailbone or coccyx is the peak of a tent where all tensions or instability anywhere in the tent can impact the peak. Here's your tailbone. Look at all the white things that you see. These are just some of the ligaments that are attached to it. Tension, any issues in anywhere else will show up at the peak. So you got to keep that in mind. When a patient comes in with tailbone pain without any incident, I know we're dealing with a chronic dysfunction in the pelvic joints, lower back, and even lower extremities attached to the pelvis. We are dealing with unstable pelvis. So what's the solution? Finding the level of dysfunction and going after it is the solution. That means you don't go after the pain, you go after the dysfunction. That's not happening out there. That's something that you will need to get help for. It's not like, what exercises do I do for my pelvic pain? When you say pelvic pain, it's a collection of things that are happening. So it's not a one exercise. This is the one thing that you need help with. But not everyone provides the right help, because when you typically go with these issues, there are these printout sheets of exercises that are given to you. But the reality is do they address the reason why you're unstable? No, that's not happening. In this office, it's all about providing you the understanding of how to be. Because if you don't understand what you're doing that is wrong and what you're doing without even realizing it's contributing to your dysfunctional patterns of movement, then you will continue doing the wrong thing. So now, if you have any questions, you can use one of the methods of contact in the description box and wherever else you can find that will allow you to connect with me and to see what's going on. Thanks for watching, thanks for subscribing, and until next time, take care.